My name is Candy Steele, and I'm going to be discussing rural and urban healthcare disparities. My introduction. Healthcare is a basic human right, but it is not accessible to all individuals. The stark disparities between urban and rural healthcare systems have a profound and urgent consequences in both populations. As we step into the next decade of medicine, we must evolve with the changes in practice and disease epidemiology, bringing care to patients even closer than before. Slide, please. On my analysis of this issue, root causes of the health disparities, one of the primary disparities was the actual geographic isolation. Rural areas tend to have fewer healthcare facilities, less healthcare workers, less specialists. This lack of resources actually delays in treatment and can continue to exacerbate health conditions and have poor outcomes. On this topic of discussion, infrastructure. Infrastructure is always a challenge in rural healthcare areas. They contribute to the disparities for various reasons: lack of telecommunications, i.e. internet services, fewer advanced medical facilities, fewer actual medical professionals to care for the patients, as well as lack of transportation to these areas. Telemedicine does have the potential to alleviate some of its challenges, but it requires reliable internet, which is not usually present in the rural communities. But pretty soon with these advancements that will be made, I think, in the past. Healthy outcomes. Health-related outcomes. Healthcare disparities in access and quality of care between urban and rural areas manifest in measurable differences in the healthy outcomes. Rural population tend to have higher rates of chronic diseases as to where the urban community doesn't suffer as much. Rural communities often have higher mortality rates, lower life expectancies compared to those who live in urban areas. In the rural communities, additional 22% of risk related to small farm equipment and heavy machinery used in agriculture. They have more frequent consequences of diabetes, lung diseases, as well as heart. Access to mental health. Suicide rates are higher, 2 times higher than those of the urban youth. This is particularly because there are lack of resources available, and the stigma surrounding healthcare issues can be more pronounced than these communities. Accessibility to these areas oftentimes is long distance to travel, and they are less likely to be insured for mental health portions on their insurance policies. Lack of availability is the true common core. Maternal health and child rates are higher in mortality because of lack of prenatal and postnatal care. Several hospitals in the areas have no longer specialized in prenatal health as well as maternity services. This also adds to the disparity. So what's the plans? Next slide, please. Improving access to the healthcare requires a multidisciplinary approach. In rural areas can involve increasing numbers of healthcare facilities, including transportation, internet services, basic utilities. But by offering incentives to healthcare providers to practice in rural communities, this would also help alleviate some of the workforce shortages. Economic support. Rural populations can improve their access for healthcare. Expanding Medicaid, offering subsidies for healthcare insurance, and reducing out-of-pocket cost to a more affordable range for rural residents. Additionally, increasing funding for rural area facilities to help them provide the quality care that the patients deserve. Community involvement, engagement and education. Engaging and educating rural communities issues are available. They're crucial. By Leading public campaigns and outreach efforts can raise awareness and also get others on board. But reducing the stigma, particularly in mental health, is also more encouraging, and also will encourage others to seek healthcare professional. Infrastructure development is very important. Improving the lack of transportation, expanding the internet services, access to telemedicine, and upgrading the medical facilities that are already there. By doing this, we can enhance our overall landscape in the rural healthcare. Next slide, please. In conclusion, the disparities between urban and rural healthcare are complex and multifaceted. Addressing these disparities requires a comprehensive approach. We got to provide economic support, engage our communities, improve access to care, and investing in our infrastructures. I do believe that allowing a nurse to have independent practice based on her abilities will help offset some of the disparities and also cut down on the workforce shortage. By taking these steps, we can look forward to an efficient healthcare system that ensures individuals, regardless of how they live, where they live, and what they need, to receive the care that they deserve. Now let's consider these two other questions. Number one, what targeted strategies can be implemented to improve access to healthcare services and resources in rural areas, particularly in addressing workforce shortages and infrastructure challenges? Number two, can telehealth and other technological advancements be leveraged to efficiently fill the gap in healthcare access and provide healthier outcomes for the rural population? Thank you.